Hi, I'm Tara Burney. I work the cardiac rehab program at Vancouver in the SCAD rehab group. Today, we're going to be talking about exercise rehabilitation and physical activities after SCAD. I have no disclosures. Oops. So why are we concerned, or what is the concern about exercise and physical activity with SCAD? So when people have had SCAD, about 50% or so of patients recall a precipitating factor before the SCAD. 25% of those is a more intense physical strain or event. So, for example, an intense isometric contraction or aerobic, like high intensity HIIT training, something that a physical exertion that creates intense Valsalva, which is again straining, holding your breath, bearing down, retching, vomiting has been reported prior, lifting heavy objects, labor and delivery, right? So obviously very straining. But the benefits of exercise are so vast. Cardiac rehab role, part of it can be helping people, supporting them after a SCAD event to feel that they are educated and understand their disease, and that they're able to safely go back into exercise and be able to monitor themselves and understand how hard they should push themselves, and also perhaps things they should possibly avoid. Now, understanding that the benefits of exercise are in the short duration, but also so much in lifelong, that understanding that and sharing that with their clients can also be a really boost to help them motivate to get back into movement. So, so many benefits: cardiovascular benefits, reducing risk of diabetes, dementia, heart disease, developing conventional heart disease, helps weight control, increasing lean muscle mass, bone density, improving your energy levels, psychosocial improvements, decreasing depression, improving sleep, and so on and so on. Overall, up to 30% reduction of all-cause mortality in people who exercise regularly. Heart specific, we'll touch on a couple things. What we'll see in the clinic in rehab, as people start exercising more and becoming more regular exercisers and get their cardiovascular health back, we can see resting heart rate start to go down. They'll find that they can exercise at a higher workload at a lower heart rate. So it's showing those great benefits. There's improvement in vagal tone, decrease in sympathetic activity. There's positive effects on the blood. Reducing platelet stickiness, platelet aggregation, reducing blood clots. Blood clots can lead to strokes and heart attacks. Then we look at the typical atherosclerosis process. Regular exercise improves cholesterol profile, boosts the good, decreases the bad, decreases blood pressure, improves insulin sensitivity, glucose management, reduces inflammation. If we look at the heart muscle and the ischemia, regular exercise too increases coronary blood flow, increases the production of nitric oxide, which helps it relax and dilate and improve blood flow to the tissue as well. So many benefits and protective benefits. So with cardiac rehabilitation, there's tons of evidence that of improvements in health, reducing all-cause mortality by up to 26%, cardiac mortality 36%, morbidity, helps people stay out of hospital after their first event, reduces stress, anxiety, depression symptoms, very common after a cardiac diagnosis. This is what I hear all the time: improvement in quality of life. People feel so much better once they get into a cardiac rehab program and start participating. Many reasons why. They improve their functional capacity. They get reduction of angina symptoms. With cardiac rehab too, we see improved medication adherence. They have the social support from their peers exercising, particularly if you can have an environment with other SCAD patients working together, very supportive. We can help support them to get back to work too. Our SCAD patients often are younger, are working, they are caring for young ones, they may be caring for their parents. These are active people, and we need to support them, and cardiac rehab can do a lot for that. And also helping them to self-manage their diagnosis and their disease. So what type of exercises? Super common question. What can I do now? Aerobic exercise, cardiovascular. This is kind of like your base, right? Using large muscle groups, repetitive rhythmic motion. We're increasing the heart rate, increasing the breathing rate, bringing in more oxygen, able to increase the blood flow to the tissues and the organs. These are things like walking, cycling, swimming, muscle strength training. Again, questions all the time about strength training. Can I do strength training? Is it safe? If so, what do I do? What do I avoid? Well, we'll address that a bit shortly, but we do want to focus on muscle strength too. We certainly do strength training activities. We use dumbbells, we use body weight, we use resistance bands, but we're really thinking about, lower weight, higher repetition. The benefits are numerous, but of course, increasing muscle mass increases your strength and the power, ability to do more. It improves bone density, helps to stabilize the joints, so many benefits. Alongside this is also muscular endurance. So what is endurance? We want to be able to use those muscles repeatedly. I think of this as like real life work. We want to be able to go up and down many stairs. We want to be able to, get up and down, picking up things maybe from the garden, picking up your Amazon box, right? This is more functional activities. You need to be able to physically do it with the strength, but also do it numerous times to be able to function in life. So the ability for these muscles to work repeatedly under a little bit of a load is a really good thing. We actually see the similar benefits doing muscle endurance type work as cardiovascular, meaning we're getting a heart rate up, we're reducing blood pressure, we're seeing improvements in blood glucose. And also functional ability to be able to do the really activities of life. Lastly, flexibility. This is something, people kind of, sometimes they love it, sometimes they forget about it, but it is also a very important component. These are movements to help stretch and strengthen and lengthen the muscles, helps to lengthen the tendons as well. This will help improve joint mobility, reduce stiffness, help people maintain their movement and range of motion. Really important, especially can be done after your cardio or your muscle strength when the muscles are warm. One thing to think about, special consideration is this high intensity and heavy lifting. This is the key of what we're trying to avoid. Of course, we're not going to be lifting the amounts of weight like this gentleman is doing in this slide, but the idea of what's happening when he's lifting it is what's guiding us to not lift super heavy and overly strain. When you're lifting very heavy things or having to strain so hard that you're holding your breath, contracting muscles in a static position, you can get quite a quick increase in blood pressure because there's a mechanical compression of the vessels. Then because the vessels constrict, because you're bearing down, you get this vasopressor response, a Valsalva, meaning basically straining, holding your breath, and then increase in intrathoracic pressure, which can result in really extreme blood pressure changes and elevations, which we're trying to avoid. So what we do, bicep curl, conventional strength training using dumbbells, resistance bands, even body weight. We're working through the full range of motion, full extension, full contraction. We're always moving. A key here, if you're moving your body, you're breathing. When we find people stop breathing and when they're straining is because they're working too hard. They're exerting themselves beyond that threshold. So a mantra we go over all the time in the clinic is, am I breathing? Can I talk? If you're holding your breath, you're probably exerting yourself, you're straining. So by doing movements and activities where you're always moving, whether rhythmically in cardio and talking, or doing strength training, moving resistance bands, contracting, relaxing, moving the dumbbells up and down, forward and back, we're always moving, we're breathing, we're talking. In contrast, the lady on the bottom, she's standing or she's pulling herself, holding herself in a static position, contracting many muscles, holding herself in the air. That is isometric. That's a static contraction. It wouldn't take very long at all, and she'd likely be holding her breath and straining. We want to avoid those kind of activities. For exertion, how do we monitor? Well, if you're fortunate and we can do an exercise stress test prior, we will typically arrange for an exercise stress test for our clients to gauge exercise target heart rate. But I realize that there's clinics that don't always have access to stress testing. There's a lot of people working from home, doing virtual. They may live remotely. They may not have an exercise stress test. So And also the stress test is about as good as the day the stress test is done, right? The next day you change the medications, change the beta blocker dose, something like that. It can change your target heart rate. So I really want to focus overall is to teach the clients how to listen to their body, understand how it feels to exercise in that moderate zone, and how to adjust if necessary. Should always be able to talk while you're exercising. If you're struggling for breath and you can't catch your breath, you need to slow down. So with exercise, you have a sufficient warm-up, at least 10 minutes or so at an easy pace. That really primes the system, slowly increases heart rate and blood pressure, preparing for the next stage of exercise. When we see problems in the gym, it's because people are going too hard, too fast, haven't had a sufficient warm-up. Maybe they showed up late and tried to sneak in at the last minute. We can continue that exercise after the warm-up to a moderate zone, always able to talk a bit during your exercise, 30 minutes or more. And then finish that down, slow it down, bring the exercise intensity and the heart rate down for your cool down. It's also a really good time to do the stretch. Again, no straining, no breath holding, and caution against sustained isometric contractions. So these recommendations, this is based on expert opinion and experience of working with SCAD patients. We're really working with on an abundance of caution rather than a lot of solid clinical evidence. Hypothesis, suggesting there's cardiac contractility or increased heart rate during exercise will lead to increased shear stress within the arterial wall and strain at high-risk segments of the vulnerable arteries, meaning if you're exercising at really high intensities and putting a lot of strain, that can maybe be the tipping point of an artery that may be vulnerable to tear and cause a dissection. Recommendations too for looking at people with FMD. This European Heart Journal, the recommendation here is avoid resistance training during the first 8 to 12 weeks after an acute carotid or vertebral artery dissection. We really just want to give you some time. For perspective, with cardiac rehab, people come into the clinic. If they get referred, we wouldn't stress test them until at least 6 weeks after their cardiac event. We need to give it time to heal, just like any other injury. So we need to avoid high intensity, high workloads, high weight loads, that require an exertion where you can't catch your breath or you're straining. Okay. Competitive sports also not recommended because people tend to push themselves really hard and don't listen to their body when they're competing. Lastly, avoiding exercise and activities in extreme temperature. So, avoiding hot yoga, the polar bear swim, the cold ice water plunges is too much stress and strain on the vascular system. Trying to adjust for temperature suddenly like that is a major stress on the heart. So overall, be sensible, warm up, cool down. Your movements should be fluid, continuous, always breathe, don't hold your breath. You should always be able to talk to your neighbor, talk to your working out partner, avoiding excessive weights, any weights or stress or strain that would cause bearing down or Valsalva intensely. We don't want to do that. Increase the duration intensity of exercise as you're comfortable and as you improve in your fitness. Avoid competitive, high intensity or extreme temperature sports. If you're diagnosed with FMD or fibromuscular dysplasia, thinking about where those vessels affect, which target organs and areas those vessels affect, being mindful. For example, if you've had vertebral or carotid FMD, you want to avoid chiropractic neck manipulation, extreme head and neck positions, contact sports, for instance. Lastly, some resources here. Feel free, check them out. There's some fantastic resources. SCADalliance.org, the SCAD Warrior app is amazing. If you've got FMD, fmdsa.org. SCADBC.com is our peer support group. They meet virtually once a month. There's a link to our virtual cardiac rehab program website as well with there's some uploaded exercise sessions, some meditation workshops even. Lots of great resources. So thank you very much. Any questions or comments? Please reach out. Happy to connect with you. My email is Tara, TAIRA.Birnie, BIRNIE @VCH.ca. Thank you.